and thank you for joining us for our session titled Trending Issue: Meaningful Research Includes Patients at the Table. My name is Suzanne Ruff, and I'm pleased to introduce this panel session. Professionally, I've been a freelance writer for the Charlotte Observer, and I'm the author of the nonfiction book, The Reluctant Donor. I am a member of the AAKP National Board of Directors, serving as the association's treasurer. I am also a living kidney donor. In my family, over 20 loved ones have battled or are battling a genetic disease called polycystic kidney and liver disease. The disease has claimed the lives of 11 family members, including my mother and a few short months ago, one of my sisters. I am the only sibling who did not inherit kidney disease. People ask me if I feel guilty about that, but I had nothing to do with my genetic makeup. But I do feel a great responsibility, which is why I became involved with AAKP, as did my father 40 years ago. I am obnoxiously passionate about kidneys and supporting families facing rare or genetic conditions which cause kidney failure. I am a staunch advocate for organ donation and living donation for at this point in time, and hope for artificial kidneys in the near future. I often say, when a person has kidney disease, the family has kidney disease. As a family member and living donor, I have had the great opportunity to represent AAKP on various research projects, including being a co-investigator on the Patient-Centered Outcomes Research Institute's project, putting patients at the center of kidney care transitions, also known as Prepare Now. Our work on this project was from 2015 to 2020, and it was an honor to know and work with the patients and other family members like myself. I've also been a key contact for companies supporting AAKP activities, and as a kidney disease subject matter expert on the AAKP Speakers Bureau. More recently, I had the honor of being one of the authors of the article published entitled Engaging Patients and Family Members to Design and Implement Patient-Centered Kidney Disease Research. Over the last 5+ years, AAKP has invested heavily in grassroots and virtual technologies to help patients and their families engage decision makers, researchers, scientists, and other influencers through our Center for Patient Engagement and Advocacy and our Center Patient Research and Education. Through our strategic partnerships with government, academia, and industry, we have been able to connect tens of thousands of new patient voices and their unique patient insights to those responsible for making informed decisions that impact some of the most vulnerable, ill, and underserved populations in the country. AAKP is building our capacities to better organize patients, address inequities, and to make certain patients have an even greater impact on issues related to care choice and innovation. Throughout the speaker presentations, it will demonstrate that AAKP is leading the way in engaging kidney patients, like you listening, across the disease spectrum in meaningful research and introducing you to a number of researchers and professionals who know the true meaning of patient engagement. It is more than a check off the box. It's the ability to put the independent patient voice at the research and policy table where it rightly belongs to drive a far larger and more representative number of patients in efforts that are already shaping the future of kidney disease treatment and public policy. Please join me in welcoming Dr. Wendy L. St. Peter, professor at the University of Minnesota College of Pharmacy.
I'm so honored to be here and been asked by the AAKP to give this presentation today. I'm being kind of the spokesperson for the initiative Advancing Kidney Health Through Optimal Medication Management. And today I'm going to focus on patient perceptions of pharmacists' role in their healthcare. I'm Wendy St. Peter. I am a pharmacist and also a professor at the College of Pharmacy, University of Minnesota. I have to acknowledge my team. It took a large team to get all the information together that I'm going to present from a survey. So thanks to all my team for helping out to make this presentation today possible. Today, what I'm going to talk about is how healthcare is changing for patients with kidney disease and why that is. And I'm going to talk a little bit about the Advancing Kidney Health Through Optimal Medication Management Initiative, or the acronym is ACHOME, and how we are using the patient voice to help us design and implement our initiative. The patient voice was very important in the survey that we sent on patients' perceptions of pharmacists' role in their healthcare. And I'm going to be presenting that data through this presentation. And at the end, I'm going to talk to you about some key takeaway messages. So as I said, there's a new type of kidney care coming. There's all kinds of forces out there that are being an impetus for change. And one of them is the Centers for Medicare and Medicaid Services. The government has recognized that kidney disease is expensive, and there's a lot of associated conditions with kidney disease, such as diabetes, high blood pressure, all of which contribute to things like heart attacks, strokes, infections that patients with kidney disease oftentimes experience. And they want to reduce the impact of kidney disease. We know that because patients with kidney disease have all kinds of related conditions, oftentimes they have numerous medication problems because many patients have complex medication regimens, a high pill burden. For instance, patients that have chronic kidney disease that aren't on dialysis take on average of about 15 pills per day. Transplant patients up to 27 to 29 pills per day, especially in the post-transplant period. Many times patients have lots of doctors because of those multitudes of conditions, and that sometimes results in potentially inappropriate medications being prescribed by physicians that aren't talking to one another. Many patients have told us they have medication access issues. Medications may not be formulary, or they can't afford their medications. And of course, with multitudes of medications comes side effects, sometimes things like allergic reactions, those adverse drug reactions. And also, when people are taking lots of medications, they don't know why they're taking them all the time. They might not be able to afford, or they have access issues. There's medication adherence problems, which mean that health-related health goals may not be met. So some of CMS goals or Medicare's goals is to decrease the number of patients who develop end-stage kidney disease. And for those that do, Medicare would like to see increased use of home dialysis, where the patient can dialyze in the convenience of their home, and more patients going to kidney transplant. And one of their big goals is also to decrease health disparities through incentives in these new CMS payment models. But obtaining these goals require a number of things. The first and foremost is patient empowerment. Without patient empowerment, we will not be able to achieve good healthcare goals in this kidney disease area. And it's going to require involvement of other healthcare professionals, because right now we have a nephrology practitioner shortage. So there's not enough nephrologists to see every patient with chronic kidney disease or kidney disease in general. And we have a looming nephrology nurse shortage coming up. And so there has to be other professionals. And what I'm going to be talking today is the pharmacist becoming part of the care team. We also need better care coordination to help patients optimize diet, their fluids, medication management, to meet their individual health goals. And also addressing mental health issues is another big issue. So goals will be hard to achieve without including pharmacists on the healthcare team to reduce patient barriers, to manage their medications in the best way for them to achieve their healthcare outcomes. It's because of this that a number of stakeholders, including pharmacists and patients and nephrologists, have developed the Advancing Kidney Health through Optimal Medication Management Initiative. Our vision is that every person with kidney disease receives optimal medication management through team-based care, including a pharmacist, to ensure their medications are safe, effective, and convenient for them to use. And as part of our mission, in order to accomplish that vision, we know we need to engage pharmacists, and we've engaged key stakeholders, and the primary key stakeholders are patients, to develop partnerships for optimal medication management to improve health outcomes, as well as to reduce healthcare costs. I am so excited to tell you that we have incorporated the patient voice from the beginning of our initiative. We recognized that having patients involved from the get-go was going to be instrumental in making sure that our initiative met patients' goals. And one of the first things that our patient engagement group decided is we needed to have a survey to determine what kidney patients' perceptions were of pharmacists as a member of the healthcare team. There isn't any information out there on that. And so the American Association of Kidney Patients, as well as Home Dialyzers United and Medical Education Institute, agreed to send our survey out to their members. And 782 people filled out the survey. And if you were one of those people, I just want to thank you from the bottom of my heart. Who filled out the survey? Well, most were greater than 55 years old. More were female. Most were white. You can see we had a small group of Black, Hispanic, and Asian patients who responded. And I have to tell you that in these areas, if we're going to change healthcare in a good way, we need voices from communities that are suffering from disparity in kidney disease. And that includes the Black, Hispanic, Native Indian populations. So the majority of people that filled out the survey were chronic kidney disease patients who are not on dialysis. You can see about 23 to 22% were in-center hemodialysis, or those with a kidney transplant. And then a lower percentage were those with peritoneal dialysis or on home dialysis. But that's a pretty fair number, considering only 10% of patients that dialyze are on peritoneal dialysis or home dialysis. So we were happy with those numbers. The first question we asked patients was, what is the type of pharmacy you use? And you can see the two predominant types of pharmacy are the retail chain pharmacies and the mail order pharmacies. Much fewer percent of patients used clinic-based pharmacies or independent pharmacies. And when I mean independent pharmacies, that means pharmacies that just focus strictly on pharmacy and medications, and unlike retail chain pharmacies, which of course have cards and sell candy and cigarettes and things. So that pharmacy is not their main operation. We also wanted to know what the main source of medication information was for patients with kidney disease. Not surprisingly, the nephrologist came out first, and the primary care physician second. But I was really happy to see that the pharmacist plus nephrologist, the pharmacist plus the primary care physicians, and just pharmacists alone were also main sources of medication information. If we're going to change and optimize medication management, the pharmacist needs to be a bigger factor. And I hope that someday when we repeat this survey that we see a lot higher percentage of patients that recognize the pharmacist plus their other care other providers like their nephrologist and FCCP are both sources of medication-related information. We asked patients, were you unsure who to ask about medications? And really, I think sadly, 20% of patients across patient types were unsure of who to ask about medications. And I'm here to tell you today, your pharmacist is the person to ask. Pharmacists have lots of education between undergraduate college plus pharmacy school, and many now go on to do advanced either specialty practice or primary care practice for an extra 2 years of residency experience. And so pharmacists are those that you ask. If you're ever unsure, ask your pharmacist. We also asked, I know what each of my medications do. Now, this is such an important question because if patients don't know what their medications do, they're less likely to take their medications. And so you can see that chronic kidney disease patients that are not on dialysis, just over 20% said they strongly agreed that they knew what their medications do, which is very scary. About 60% of transplant and home hemodialysis patients strongly agreed they knew what each of their medications did. But honestly, we need 100% of patients or their care partners to understand what the medications do, because if you don't understand what your medications do, again, people are less likely to take them. We also asked if patients were positive that they took their medications right. Again, we saw that just over 30% of chronic kidney disease patients not on dialysis said that they were positive that they took each medication right. And you see again, home hemodialysis patients and transplant patients were more likely to feel positive that they were taking them right. But as I noted before, we need 100% of each of these patient types to know that they're taking their medications right. And that is because we want each patient to meet their medication-related goals in their healthcare. We asked, do you consider the pharmacist where you get prescriptions to be part of your team? And actually, I was surprised at the high percentage of patients of each type, except for home hemodialysis, that noted that the pharmacist was part of their team. I was actually surprised, and I'll talk about that a little bit more in a moment. We did go on to ask patients if they didn't feel that the pharmacist was part of their team, why? It's very sad for me as a pharmacist to see this, but 44% said no interaction was initiated by the pharmacist. 12% said the pharmacist was too busy. Some said that the interaction wasn't helpful or the pharmacist wasn't competent. I think it's not as surprising knowing where patients are getting their medications. So from the retail chain pharmacies, as well as from mail order pharmacies. Of course, mail order pharmacies, there isn't going to be an interaction initiated by the pharmacist because the patient themselves have to initiate any interaction. But especially in retail practice, our pharmacists are oftentimes slammed to the wall with just all their other duties of simply getting those prescriptions out. And there's a lot of pressure from those retail chains for the pharmacists to dispense as many prescriptions as possible, just for the bottom line for the company. So I'm here to tell you that if you have experienced those things in your pharmacy, then you need to find another pharmacy. We have retail chain pharmacies out there as well as independent pharmacies that do enhanced services. That mean they meet with patients, they may do a medication review, they may focus on diabetes or high blood pressure management and monitoring, and they will oftentimes give a plan to you as well as to your physicians. And that's the type of pharmacy that you want to get your medications prescriptions from if you can, because those are the pharmacists that will learn who you are and they will be aware of what your medications are and can communicate information between not only your physicians but also back to you so everybody's on the same page. Relating to the team-based care, we asked the question, my pharmacist works with my nephrologist. And if you notice, the vast majority of all patient types said either no or they were unsure. So I go back to the previous slide that we saw, that a lot of you, or a lot of patients that answered the survey, said their pharmacist was part of their team. But being part of a team means that each one of those team members interacts with one another. So the pharmacist interacts with the physicians, either primary care, nephrologists, or others. And all of those practitioners are aware of what you, the patient, are taking and communicate with each other. So to be part of a true team, there has to be communication with the patient in the center and all the other team members communicating. And oftentimes, pharmacists are a perfect conduit of communication for medication-related information between the patients and their physicians or other healthcare providers. And so we want to make sure with our initiative we're addressing this, and that, again, in another survey, we have 100% of patients say, my pharmacist is working with my nephrologist or my other physicians. We asked, have you ever had a bad experience or side effect with your medications? In other words, did you have an adverse drug reaction? And not surprisingly, given the number of medications that kidney patients take, a large proportion of patients said yes. So in the case of a home hemodialysis patients and transplant patients, over 50% said they'd had a bad experience or a side effect. So we asked patients to explain a little bit more, and we kind of grouped these adverse drug reactions into either patients didn't provide any details, so about 38% did not, but 45% of patients indicated they'd had a mild to moderate reaction, and then 17%, so 17 out of 100 patients said they had a life-threatening or severe reaction. This is why pharmacists need to be involved. We want to prevent any adverse drug reactions, but we know that patients will have side effects, but we can mitigate those and also work with patients to make sure you get the right medications you need that you can tolerate. So that's really essential. We want to make sure that, for instance, if we get this question again, that much fewer patients have reactions. As a follow-up, we asked, has your pharmacist ever prevented or resolved a bad experience with medications? And you can see somewhere on average of about 20% of patients across all patient types noted that the pharmacist had resolved a bad experience. And I think, as having pharmacists as members of the healthcare team in patients with kidney disease, you'll see that percentage go up much higher. I want to summarize what I've talked about here today and what the results from the survey, to say that pharmacists bring value because pharmacists can empower patients to take charge of their medication-related goals by making sure their medications are safe, effective, and convenient for them to use. They can help patients resolve their med problems and prevent medication problems. Importantly, they can work to improve medication adherence by reducing, barriers such as cost barriers, formulary barriers, having patients understand why they're taking each medication and how to take it right. All of those things improve medication adherence, which then improves outcomes and health outcomes. They also address barriers to medication use, as I told you, some cost barriers, formulary barriers, maybe barriers to taking certain types of medications like tablets or capsules if they're too big, those sorts of things. And in that way, pharmacists can help reduce disparities. We know that our Black and Brown Americans oftentimes aren't getting the same preventative medication to reduce kidney disease progression as white patients are, and that needs to change, and pharmacists can help out with that. Pharmacists are also helping in the COVID-19 crisis by getting patients vaccinated, and that's been true for dialysis patients as well as chronic kidney disease patients. So some key takeaway messages are that we have many forces out there, the government, kidney care companies, health systems, and just, practitioners themselves that are working to improve kidney disease care. But improvement in patient-centered healthcare won't change without patient input. I'm just, again, proud that our initiative is including patients at every step. Patients are helping us inform our strategies, our communication, as well as pharmacist training to make sure that we do the best that we can do to address problems that patients have, not that problems that we think they have. Ultimately, why are we doing this? Is because we want to ensure safe and effective medication. I want to thank all of you who have listened to this today. And if you're excited about this initiative to optimize medication management, I'd like you to become involved in our initiative. And if you are interested, please contact me at my email address. Thank you.
Thank you, Dr. St. Peter. AAKP is proud to be a partner in your research project to demonstrate the important role pharmacists can play within the healthcare team. As I come from a family with many transplants, I can tell you the pharmacist's role is critical.